My name is Arminta Graham. I have 3 children. I'm also a grandmother of 6 and a great-grandmother of 1. In 2022, I was moving into a new apartment and my shoulder kept hurting. Like I couldn't move it. The pain was like unbearable. I went to the hospital in the ambulance. 2 or 3 days after I was admitted, they told me that I had aggressive cell B lymphoma. Everything stopped. Like my whole world stopped. And then he said, and also we see that you have a broken neck. The cancer made that bone break. It just was the most devastating news ever. They said they was going to stop me on chemotherapy to see if they can handle it that way.
She presented with a very bad disease. This was a lymphoma that was not responding to any chemotherapy we had tried. And unfortunately, her disease was progressing. So we began to think about CAR-T therapy being an option for her. We had never offered this therapy to anyone else at BMC before. And it took a few weeks before Arminta was comfortable moving forward with this approach.
I never heard of it. I was scared to death.
It was understandably a very difficult decision, but eventually she decided to move forward and became our first patient treated with CAR-T.
As the inaugural Chief Scientific Officer at Boston Medical Center, I envision BMC will be leading the country in addressing our patients and thereby the country's toughest health challenges. We will be able to bring treatments, therapies, interventions to them much more quickly.
BMC is the only safety net hospital currently providing access to these therapies. We hope BMC can be a model for other hospitals in the US. We have an excellent clinical research program that is fully invested in providing access to novel investigational therapies to our patients.
BMC both has the opportunity and also an obligation to lead in the space of inclusive research to ensure that participants from all different races, ethnicities, countries of origin are able to participate in our research so that we know when we find the results that they are broadly applicable.
I am so happy that my family talked me into, giving CAR-T the shot.
Arminta responded very well to this treatment, and she's now over 14 months since her treatment with CAR-T. This is the best possible outcome we could get.
BMC was very supportive. They gave me the PET scan, and Dr. Petrocca said the cancer was gone. They don't detect no cancer in my body at all. It really worked. Now I'm not on no medication. I had like 6 medications I used to take a day, and now I have none. I never have no pain. I feel great. I wouldn't change getting my care at Boston Medical for nothing in the world.